announcement is important for you guys, also important for the folks that aren't here, so I'll be sure to repeat it. As you guys have seen, Dr. Khan has put out, I guess we'll say, an emergency grading procedure. And basically the idea being that if you get to the end of the semester, right, and so all the grades are calculated and you see your grade, you have a choice to say, I want my letter grade, or I rather have a P for pass, right? And no matter what system you use, an F is an F, but in this case, a D and up is a pass. And I'll send out, I guess, kind of the official document that we got. I'll send that out to the class so you can see that. Now, the only kind of caveat is that I kind of set, we'll say, the attendance policy. And so I could say, if you miss this number of classes, well, then you don't have that choice regardless, right? So that's kind of the little bit of the power that I have in it. And I think what I'm going to do is, and I can count those classes for you and let you know what that is on Wednesday. But I'm going to say essentially that between now and the end of the semester, you are allowed one miss with still having the ability to choose the pass fail if you would like. Now, I realize we have a couple of folks missing, and I'm assuming that could be weather related. I know at least one of them is. And so, I'm not going to have this policy start until Wednesday. Now, if you have been severely affected by weather and something comes up, that's fine. I can work with you there. And so this is giving a couple days, hopefully, for people to kind of get things a little more normal if they've been altered. So starting on Wednesday, the plan would be right now, you'll be allowed to have one more miss for the rest of the semester. There really aren't that many classes left, so I don't think it should be that hard for you guys, and attendance has been great so far. So if you have any questions about that or want to talk to me about that, please, let me know. Again, right, if you have an A or if you have a B, you're probably going to choose the letter grade over the pass-fail option. Okay. Yeah, Peyton. So, the short answer is I do not know how that affects scholarships necessarily, other than if you choose the pass, right, then that class would still show up on your transcript, but it would not count towards your GPA. So you'd still get credit. And so in that sense, I don't think it would have a drastic effect, but that would be, you'd have to check specifically if we're talking about like a Lee scholarship, or if you are talking about that, you can shoot me an email and let me know, and I can double check that for you. I do know that even like medical schools have said that they totally understand if for this semester students have, P's instead of letter grade. And so, people are being, it sounds like, relatively accommodating. So I assume your scholarships would be fine. Again, if you choose the P, it doesn't count towards your GPA. All the classes that you do choose a letter grade for count towards your GPA, though. So I don't know if that answers your question. If it doesn't, shoot me an email and I can dig up and find the answer for you or direct you where to go. All right. Any other questions about the pass-fail option?
I have a question.
Yeah.
Okay. I wonder if you would know how that would work with, like, we have to get a C for nursing. We have to get a 74 plus. So I wonder if we took the pass, would that, like, if we took the pass and it was a C, would that, like, how would they know what the pass grade was? Will we have to take a letter grade so they would know what the letter grade was?
Emily, that's a great question. Let me, for those of you that are nursing, because I know that's a lot of you, I will email Jake and just double check with him for you guys, okay?
Okay, thanks.
I'm assuming that if you would take that option, he would probably check back with me when it was time to evaluate you guys and just be like, okay, we saw that Emily took a P, right? Did she have a C or did she have like a D, right? And I'm not saying that's where you're at. I'm assuming that's what would happen, but I do not mind checking with him and how that affects your guys' applications and requirements. Okay, cool. That's a great question. All right. Anybody else? Maddie, any questions yet?
They're funny.
I know, right? But I assume it's coming sometime soon, so I'm ready.
Yeah, probably.
Okay, nothing major. All right, let me share this. See where we're at. Okay, this is where we're going to start, even though I know we had been here before. So we're going to probably finish up chapter 10 today. If not, we'll finish what's left of it on Wednesday. And please remember that, oh, hold on. Sorry, I need to close the door so that the sound of my wife and child does not disturb us. Sorry about that. All right. So basically what I was getting to is there will be a quiz on Wednesday, and I believe that will be quiz number 10. So then my plan is to squeeze in at least 2 more quizzes like that. So that would put us at 12 and would I'll give you guys 2 drops. If there's a way I can squeeze in more, I might even, try that. All right, so we might even go like next week or this week, I haven't decided yet. We might even do 2 quizzes a week to try to get you guys some extra quizzes to maybe drop some of those previous low scores. All right. Okay, so let's start.
I have a question, Professor Daft.
Grace Henderson, I have an answer.
Okay, so this is about the exam. I don't know if you know this or if anyone's told you, but there was a question where it was both A and B.
Right, I messed up. Yeah.
Okay.
Sarah told me about that question.
Okay, cool. I was just wondering.
Because she brought it up early, I'm gonna give her points back and no one else.
Okay.
I'm just kidding. I have it written down. I'll probably, I think, was it a multiple choice question, right? Yeah.
Yeah.
So I'll probably just go in and just add a couple points.
Okay. Thank you.
Okay. Cool. Good question. Thank you for reminding me of that. Grace, you're just adding stuff to my list.
You're welcome.
Yeah. Well, I know, but that's 2 points to your exam and 4 points off for giving me more work. So it's still a net loss of 2 points.
Nice.
Yep. That's the way I roll. Okay, cool. I will try to look into that. I don't know if I'll get to it today. I put it on my list for tomorrow. And so, give me time there. And I promise I haven't forgotten about Chem 21. I know some of you asked about that. So I will try to get to that this week so that it's open for you to go back and finish anything that you maybe want to finish, and also give you a chance to maybe even review some stuff before the final, right? And I'll shoot out an email with all those dates and stuff here maybe a little bit later today. But anyway, let's get started with material. Again, if you have a question during this, shoot something in the chat box or raise your hand or just call out to me. I don't have Anna here to kind of help me peruse. So I will do my best to get to you. So a couple, quick things to revisit. We'd started talking about an action potential. And Peyton, can you remind me what voltage I have to hit in order to open voltage-gated ion channels to start an action potential?
Is it the -71?
That's resting.
Yeah, I have no idea.
No idea. Okay. Fair. Let's see. Jennifer, what you got for me?
I also have no idea.
Todd? So you start off at -70, and you have to have a depolarization event to get to what to open those voltage-gated channels?
-55.
-55. Todd, you sound a lot like Haley. That was weird.
Yeah, it sounded like somebody different than Todd, but I'm okay with if she wants to answer.
Okay, perfect, right? So Haley's right. So that's -55.
I was good at okay.
Don't worry, Todd. I got another one for you. Don't worry, bro. I got you. All right. So Todd, -55 opens voltage-gated channels. To go from -70 to -55, what type of channels did I open now?
The channel itself?
Well, so you have two channel types, right? That's what I'm going at. So voltage-gated channels open when you hit -55. But another type of channel that's kind of similar opens, right, to take you from -70 to -55 so that you can open the voltage-gated channel. So what type of channel is opening when you're at -70 to take you to -55?
I'm actually not sure, to be honest.
Okay. I appreciate your honesty. Who can help him out?
It'd be chemically gated channels.
Okay. Noelle, was that you?
Yeah.
Okay. All right, good. So it's chemically gated channels. So remember, neurotransmitters are going to act on chemically gated channels, right? They're going to open those channels. Sodium is going to rush in. It's going to cause a depolarization event if there's enough of a stimulus, right? Which will then change the membrane potential, or remember I said you can call it membrane charge from -70 to -55, which opens the voltage-gated channels, right? Which are in the axon hillock and run through the axon that start the action potential, okay? And that's kind of what leads us here. So here you can see, right, these tubes representing axons of neurons. And on the outside, you have sodium. On the inside, you have potassium. Remember, one of the things that contributes to our resting membrane potential is a sodium-potassium pump, pumping sodium out and pumping potassium in, creating concentration gradients so that when we open channels, ions are going to rush one of two directions, okay? So here you have, you're resting, a stimulus, right, hits you, right? So we've reached that threshold potential, so now we've opened our voltage-gated channels in the axon. That causes sodium to rush in, right? And that stimulus would go down, sodium would rush in, stimulus would go down, sodium would rush in. Remember, shortly after that, that same stimulus, all right, there's a slight delay, but it opens potassium channels, and potassium is able, right, to then rush out, which causes repolarization, which allows that axon to then send another signal almost immediately, okay? And if you remember from last week too, one of the things that we mentioned is some of you are like, well, what happens to the sodium that's in here? Does it go back out before another action potential happens? And the answer is no, it probably does not if the signals are really close to one another. What it's not showing you here is that even when that potassium rushes out or that sodium rushes in, there is still an abundance of each respective ion. So there's still a lot of sodium on the outside and a lot of potassium on the inside. And so even though the sodium has moved in, there's enough sodium still on the outside that if another action potential happens, right, more sodium can rush in. And then eventually down the road, the sodium will likely be pumped out by the sodium potassium pump. But you do not have to wait for the sodium that rushes in this event that we're looking at for another signal to start, because there's enough sodium on the outside and there's enough potassium on the inside that even the movement during this action potential does not prevent another action potential from happening as long as the charge is correct inside.
Is there some type of regulatory function that's going on to maintain enough on the inside and outside?
Yeah, so I mean, so that would be the sodium potassium pump.
Just the pump itself.
Yeah, so it's always working,
Okay.
right? Even when there's no action potential going on, even when there is an action potential going on. So that's going to be kind of your main, regulatory, I guess, kind of system. If you go back, farther, when I first showed those neurons, it honestly is going to be a combination of those negatively charged ions that you have stuck on the inside, the sodium potassium pump working, along with, right, because you have these gradients set up, some sodium's going to leak in and some potassium's going to leak out. And so it's all three of those things that are kind of working together to maintain, we'll say this normalcy or this equilibrium that allows another signal to occur. Right? That's a really good question, Todd, because that's kind of one thing you have to keep in mind, right? What allowed the system to be at this point? And then how is the system essentially kind of resetting itself after a stimulus, right? So yes, please ask away when you have questions like that, because I really do want you guys to understand that, because I'll just give you a heads up, right? Much like the muscle contraction question, which we actually still may talk about here again at some point, especially before your final, which I was so okay with a lot of your answers. This is going to be a big, kind of question, right? Basically, starting from the stimulus from a neurotransmitter interacting with a chemically gated channel, right? Causing a depolarization event, causing a threshold to be reached, right? And so boom, 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 kind of down the line is what I'm really going to be interested in from you guys. So I want you to put together this kind of big picture of this process.
The funny side note, my mom, who's a physician and is retaking her boards, actually had an acetylcholine question to study for, and it was the fact that the calcium pump actually starts the process, then the acetylcholine, and she actually was even thinking of it as acetylcholine, but then said that the calcium actually activates the whole system.
Huh.
That sound a little bit accurate?
Yeah, I'll have to go back and check that.
Yeah, because she was like, she thought, again, like you said, the acetylcholine is the first thing, and it was actually like when they looked at it, it was like you had to have calcium first, then the acetylcholine activated the muscle, and then the rest of the process that we've all discussed went on.
Right, which I guess, yeah, because the calcium pump is always working like the sodium potassium pump. But I guess, and I'd have to go back and look, because that sounds like they're saying then that the membrane permeability that's induced by acetylcholine is dependent on calcium.
Right.
Yeah, I'd have to go back. Yeah, that could be true. And that
I mean, it was a med school question, so it was pretty advanced, but it was just interesting.
But still, huh, that's interesting. I'll have to go back and check that and see. Yeah, I don't know, the textbook
Definition.
maybe just leaves that out and waits for med school for you. But I don't know. Yeah, I'll check. That's interesting. But anyway, so let's keep going though, and talk about the actual action potential. So here, right, we're looking at, what are the movement of ions that are generating this action potential? And then over here, right, we are looking at it just based on charge, right? So if you remember, that resting membrane potential is negative, so that's why you see all these negatives here, because the inside of a neuron has a negative charge. But as an action potential moves down, right, we see pockets of positive charge, right? And these pockets of positive charge, if you go back over here, are being driven by sodium ions moving in. I also love this image because it shows you that this process is segmented. It's not just one continuous signal that moves down the axon. It is a series of individual signals that are stacked together that are generating that impulse that we think of when we talk about neurons, right? And so the positive charge here causes a depolarization event that opens voltage-gated channels downstream. Sodium moves in, depolarization event, channels open, sodium moves in, and it happens right in a segmented fashion. Okay? And this actually kind of sets us up rather nicely for what myelin is doing, right? So if you look in the textbook, myelin is an electric insulator, right? So it insulates the axons, and you'll see why that matters here in just a second. Now, one of the things that makes me nervous, and I hate bringing this up, but it is important to bring up because your textbook talks about it, and conceptually it kind of represents what's going on. So maybe, I hope not, but I wasn't there. Maybe if you've had A&P before, it was in high school, maybe it was, you know, some type of dual enrollment, and it just, it's a little different, all right? Oh no, why did this do this again? Come on. Okay, there we go. Look at this for a moment. There we go. Well, I can't really see where my mouse is now. But we get this impression, right? Maybe for something that says the signal skips the myelin sheets, right? And so it kind of looks something like this, what I'm drawing. All right. And that's actually what it looks like if you are focused. If you're focused on the nodes. And so you can see when you go to the nodes, that's where they're showing you your positive and negative charges. All right. So within the nodes of Ranvier, right, you have voltage-gated channels. And what would happen if we had an unmyelinated axon? See if I can exit out of here now. Okay, well, I'm losing control here.
If it didn't have any myelin, then would it basically always be trying to?
So, go ahead and finish that. I'll let you finish.
Well, I was gonna say, so I mean, it's an insulator, and it's preventing ion flow. So would you basically have an uncontrolled ion flow if there was no myelin?
No, it's not uncontrolled. So, I mean, that's actually a great question because that sets that up kind of nicely. What myelin does is it increases the speed that a signal can move, all right? If you don't have myelin, what's going to happen is you're going to have to open voltage-gated channels down every segment, all right? Now, kind of to Todd's point, what's going to end it is that it eventually is going to reach the synaptic bulbs, right, at the end of the axon. And we'll kind of mention it here actually in just a little bit. I think we'll get there. When that impulse hits the end of the axon, what it does is causes membrane permeability to increase, and calcium will actually rush in. And that's what's going to allow those little vesicles that contain neurotransmitters to bind to the membrane and then release them via exocytosis. And so regardless of how it gets there, once that action potential hits the bottom, right, it causes that change in permeability and calcium moves in, all right? But the speed is enhanced by myelin because what you see here is sodium rushes in, right? So you generate that impulse. And because this myelin's wrapped around the axon, there's no channels in here that are open. And so the signal is actually able to travel through this myelinated section without having to open any channels. Once it hits this segment, the impulse is basically, I would like to say, this is not accurate, but I'll say re-energized, because it technically actually is a new impulse, but it's re-energized. It travels through this section of axon, hits here, opens these channels, re-energizes, travels through here, boom, 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 moves all the way down, right? If we don't have myelination, which some nerves are not myelinated, then you're opening channels in each segment, right? And so it just slows it down significantly. All right.
So I have a question.
I have an answer.
So is this why that our signals are like fragmented? Is because of the myelin or like the Schwann cells, because it has to jump from node to node?
Fragmented in what sense?
From like the last picture, like from the ABC, like showing that it doesn't happen with every single like sodium and potassium.
Okay. So why did it do that? Oh gosh, I hate this thing. Oh, I just saw it. Give me my mouse back. There we go. Shut you off. Okay. So I mean, I think kind of yes, kind of no, and I'll explain what I mean here. So if you were to apply this picture directly to the image on the slide that we were just on with the myelin, you could look at this as a node. All right, so this could be a node of Ranvier. All right, the difference would be is that, yeah, you don't need these channels on either side of this because they're going to be covered with a myelinated sheath and they can move through quickly. All right, so if you were to remove a myelinated sheath, right, and this is not like a true scientific calculation, right, but let's say you know, there's myelin here and there's myelin here, and you removed it. Well, now you have to open every channel in here, and you have to open every channel in here. And so fragmented, I mean, again, I guess it appears fragmented, or I guess it is fragmented in the sense of you're opening channels in one node at a time. So basically, if you want to think of it in the fragmented sense, you say, okay, this is a fragment right here. This is a fragment right here because these channels open to generate the impulse. So here's a fragment, and here's a fragment. Does that make sense, Noel?
Yeah, that does make sense.
Okay.
Thank you.
Good. For any of you that are confused, go ahead and ignore what I just said, or if you need more clarification, go ahead and ask now or shoot me a message in the chat box. All right. So this is not necessarily a new concept for you, this idea of synaptic transmission. But one of the things that we haven't really kind of touched on too much is the effect that individual neurons can have on the neurons that they are forming junctions with. All right. And so you guys already know this, right? The fact that neurotransmitters are binding to a postsynaptic membrane, right? So that would be the target neuron in this case, because we're talking about neurons interacting with one another. And when they do that, they open chemically gated channels, which you guys know that. All right. What we haven't really focused on is that these chemically gated channels, all right, don't always open up and let sodium in. What they can also do is open up and let potassium out, right? And so it is the synaptic potentials of all of the axons that are interacting with a target neuron that determine if a signal can be generated. And if you're like, what the heck does that mean? Well, here is an image, all right? And this has actually been simplified in the sense of it's possible for an individual cell body of a neuron to have up to 1,000 touch points, right, with other neurons, right? So here, 1, 2, 3, 4, 5, 6, 7, 8. Looks like they have 9 touch points, and even a couple of them are coming from the same axon that's branched, right? So there could be a lot more of these connections. And so this introduces this idea of inhibitory postsynaptic potential and excitatory postsynaptic potential, right? IPSP and EPSP, right? And it's really important that you know what especially that I stands for and what that E stands for. And basically that's a fancy way of saying that some of these axons may be releasing neurotransmitters that excite this neuron, all right? And when we excite a neuron, that means that we're leading to a depolarization event that is going to potentially allow us to reach a threshold potential. So that means what ion is moving and in which direction, Kaylee? If I'm exciting a neuron, what ion's moving and which direction is it moving?
I don't know.
Well, I mean, how many ions do you have to choose from? You have 3, right?
Mhm.
Sodium, potassium, calcium. So which one? Choose one.
Sodium?
Okay, I can work with sodium. When I excite a neuron, is sodium rushing in or rushing out of a neuron?
Sodium goes in.
Sodium goes in, right? So good. So excitatory postsynaptic potential, a neurotransmitter, right, is exciting that neuron by binding to a chemically gated channel, which is going to open and sodium is going to rush in. For inhibitory postsynaptic potential, that means, right, that a hyperpolarization event is occurring. When a hyperpolarization event occurs, that means the cell body becomes more negative, or the neuron, not just the cell body, the whole neuron. The whole neuron becomes more negative for its membrane potential. So in that case, we'll go with Chase. What ion is moving and in which direction?
Is it potassium moving out?
Potassium moves out, right? So when potassium moves out, you're taking a positive ion and you're kicking it out. That causes a hyperpolarization event, which makes the cell more negative, which prevents those voltage-gated channels from opening. Now, here's the thing, right? And again, I'm just making this up, but 5 of these connection points could be excitatory, 5 of them could be inhibitory, all right? So you can have both neurotransmitters released at the same time, and it essentially becomes who overcomes who. The EPSP, that excitatory postsynaptic potential, can be strong enough to overcome the inhibitory postsynaptic potential that's happening at the same time, or vice versa. And so it is the conflict between those two that ultimately determines, is a signal generated? All right, Maddie, what you got?
Okay, so my first question is about just like generally the potentials is it like a process that we move through, or is this like each different potential happens in a different type of scenario?
I'm not sure if I understand what you mean.
Like, do you go from like resting potential, then you move on to I can't think of the names, but you know what I mean? And then, Or is it like, your body's receiving this kind of like signal or stimulus, so we're gonna, I don't know. That probably doesn't make any sense.
Okay, I don't know if I mean, so, the default position is to be at rest. All right.
Okay.
So the default position is to be at -70. And that's when I was talking earlier with Todd. You have the sodium potassium pump. You have phosphate and sulfate, those negatively charged ions that are trapped inside the cell, along with the leaking back and forth of sodium and potassium. All right. So that sets up resting potential. So that's kind of a default setting for a cell. Right, and then you have to open those channels in order to reach threshold. And as soon as that stimulus ends, that has opened those channels, then we go back to our default of resting potential. So I don't know if that answers your question.
Yes, it kind of does. So then with, well, yes, it answered my question. Sorry. So, I also have,
Okay, go ahead.
oh, sorry.
Let's go.
I also just wanted to ask, and you may have gone over this, but so is sodium always flowing in then?
Is sodium always flowing in? Sodium is going to be the ion that flows in for you to try to cause a depolarization event. Potassium is always going to be the ion that's flowing out when you've opened the channels to either cause a repolarization or a hyperpolarization.
Okay.
Is that
Thank you. Yep.
okay? And if that other question, if that's not answered, I mean, maybe think about it a little bit more, or maybe write it out and send it to me, and then maybe I can try to kind of process with my neurons exactly what you're trying to get at. Okay.
Yeah, you definitely answered at least for like resting and threshold, because I was just confused if they flowed together, if it was like a step-by-step type of thing. Or if it was just like they were separate events. But you definitely answered it for me. So
Okay, good. I'll take it. I'll believe you, and if satisfied, email me, and we can talk about it via email or meet to discuss it. All right. So very briefly, let's talk about neurotransmitters. All right. So within your body, right, you have over 30 neurotransmitters that are produced. All right. And you basically have a couple different options based on what type of neurotransmitter you have. Neurotransmitters are either assembled in the ER and then transported down the axon and placed in synaptic vesicles, awaiting stimulation to be released, or neurotransmitters can be put together in the terminal ends of axons and then released from there, right? So the question is, right, are you making it in the ER and sending it down the axon to be released later, or are you just making it at the end of the axon where it can then be released upon stimulation, right? So that's kind of your two options there. And this is what I kind of mentioned earlier when I was talking about calcium, all right, is when an action potential hits that synaptic knob, right, that terminal end of the axon, it makes the cell permeable to calcium, all right? And calcium, right, will then help or allow synaptic vesicles to fuse with the membrane, right, in that terminal end of the axon and release neurotransmitters via exocytosis. Now, if you remember from our tetanus discussion, there are multiple proteins that also aid in this process, right? So it's not just as simple as calcium comes in, right? The vesicle binds to the membrane, it then releases, and we're good to go, right? There's more at play, but these are kind of the big things that I want you to keep in mind, all right? And so for some of these neurotransmitters, right, and this is not an exhaustive list at all, but these are some of the bigger neurotransmitters that you guys have probably heard of, right? So acetylcholine, we've talked about that multiple times, right? Specifically, right, as it relates to controlling skeletal muscle. So there's nothing new there. Dopamine, and we'll talk about this a little more detail in just a second. You've probably heard of, right, a sense of well-being, If you've known someone with Parkinson's, right, we know that there's dopamine issues there. If I can't remember what the movie's called. It's with Robin Williams. He's a doctor interacting with Parkinson's patients. Robert De Niro is also in it. And he's a doctor that kind of figures out if we hit these patients with a lot of dopamine, we actually reverse the symptoms of Parkinson's. But in this case, right, their body kind of develops a tolerance and the medication no longer works. Serotonin, if you've ever dealt with insomnia or depression, right, this is a neurotransmitter that you probably care about. We also have, right, oh, and I don't know if you noticed here, but it kind of has different categories like biogenic amines, amino acids, neuropeptides. And so different combinations of proteins, but then you also see there are gases. But a type of neuropeptide, which I'll actually talk about these in a little more detail, we probably won't get to it today, are enkephalins and endorphins. And so if any of you have been to the hospital, these closely resemble or mimic morphine. All right. And we'll talk about why that's important in relationship to substance P, which actually causes pain perception. So you can see that these two kind of have the opposite effect. What I'm going to do, let's see. Yeah. So we'll do this really quickly and then I'll let you guys out here. This won't take long. So this is just some disorders that are associated with imbalances in neurotransmitters, right? So depression, right? Some of you may have dealt with depression, and this can be really severe depression if we're talking about clinical depression, right? So deficiency in norepinephrine or serotonin, right? Some of you deal with insomnia, maybe at a severe level, right? Deficiency in serotonin. Parkinson's disease, right? I said dopamine, schizophrenia, you lack the neurotransmitter GABA, which leads to an excess of dopamine. All right. Some drugs that alter neurotransmitters. So we talked about tryptophan, right? Interacts or alters serotonin, which is why you feel sleepy after large meals that have tryptophan in it. If any of you have taken Valium for anxiety, right? It enhances receptor binding of GABA. Nicotine, for those of you that have maybe smoked or know someone that smokes, it increases alertness, right? So it's, some people that work certain jobs are more prone to smoking because this gives them a little bit of a pick-me-up. And then cocaine, which I hope none of you have ever done or none of you do. But what it does is it blocks reuptake. And this would be the last thing that I end on really quick. If you remember from acetylcholine, you had acetylcholine esterase, and acetylcholine esterase removed excess acetylcholine, right, from that synapse between the neuron and the target. Some neurons also have uptake. And so they release a neurotransmitter, and then they're able to take that neurotransmitter back in. And it's the same effect. You're removing it from the system, so you stop that signaling event, right? What cocaine does is it blocks the uptake of dopamine. So you release dopamine, and then it doesn't get taken back up. So you have extra dopamine in the synapse, which, again, dopamine, also called the feel-good hormone, creates an extra sense of euphoria, right? And we'll talk about kind of overuse of those receptors maybe really briefly on Wednesday, okay? So that's it. So remember that you have a quiz on Wednesday. If you haven't typed here or hi for some reason at all, please go ahead and do that so I can make sure that I get you on the attendance sheet. Maddie, what you got for me?
So would those things highlighted in red on the last 3 charts be important to?
Yeah, I might ask questions on those. So that's why I just highlighted a couple, because I don't want you guys to have to memorize everything on the charts. But those are some that may be relevant to some of you, and some of those are neurotransmitters that we've talked about before.
Okay. Okay, so just kind of have a general understanding then.
Yes, ma'am.
Okay, thank you.
All right. Anybody else? All right, go ahead, check, right? All your grades should be posted. I'll add some points back for that one question. If you have anything else, go ahead and shoot me an email. I haven't forgotten about Chem 21. Todd, keep on harassing me about that. You're my main Chem 21 motivator. So stay on me. I'll try to open that for you all this week. It was great to see you, and I will catch you all later.